it's so easy to deliver.
It's very easy to insert compared with the gel.
It's there and they're not conscious of it.
The big advantage is it's a slow release device.
It's a more gradual onset to the induction process.
It's also very easy to remove.
It's really very simple, easier than removing a tampon.
Which all adds up to control in cervical ripening. Although most pregnancies are uncomplicated and the majority of births take place naturally, as many as 1 in 10 women will require a labour induction in either maternal or fetal indication. In many cases, the cervix will not be ripe and not ready for labour. This increases the risk of prolonged labour and caesarean section. In such cases, there is a need for cervical ripening.
If the cervix is unripe, it's very important to take time and trouble to make the cervix ripe before inducing the strong contractions of labour. Otherwise, it'll be a case of those contractions taking place against a rigid cervix. Consequently, labour will be longer and more stressful for the mother and more dangerous for the baby.
Although a number of techniques have been available for ripening the cervix, many physicians use locally applied prostaglandins for this purpose.
We've known for a long time that prostaglandins are the appropriate agent for cervical ripening, but hitherto we've had to rely on giving comparatively small doses because we were worried about rapid absorption of larger doses, and therefore the need for frequent reassessment and commonly repeated administration. Whereas the formulation of Propess allows such a steady release of an appropriate, slow and comparatively low dose that it can be left over many hours and produce the gradual effect on the cervix.
Propess is the first vaginal insert which allows sustained release of prostaglandins over a period of up to 12 hours. Each pessary contains 10 milligrams of dinoprostone. Approximately 0.3 milligrams are released each hour as the pessary hydrates within the vagina. Propess is indicated for the initiation and/or continuation of cervical ripening in patients at or near term, with a Bishop score equal to or less than 6.
It's very easy to insert compared with the gel. It has a low incidence of hyperstimulation because it's a controlled release device, and if there is any evidence of hyperstimulation, it's very easy to remove.